Hi, my name is Gianna Acuna, and I'm doing chronic heart failure for EXS 486. What is chronic heart failure? Chronic heart failure is an overflow of fluid in the lungs and or body over time caused by insufficient pumping of the ventricles, also known as CHF. It is the leading cause of hospitalization in people over 65. It can be caused by heart attack, BMI over 30, arrhythmia, diabetes, cardiomyopathy, congenital heart disease, hypertension, smoking, family history, and alcohol. These are considered high-risk patients. So some of the symptoms that people with CHF might experience are shortness of breath, chest pain, swelling in ankles, feet, legs, and abdomen, irregular heartbeat or palpitations, fatigue, rapid weight gain, dry cough, and nausea and lack of appetite. So the types of chronic heart failure include left-sided heart failure, can be systolic failure, or which is the inability for the ventricles to contract normally. It is less than or equal to 40% of blood ejected. Or diastolic failure, which is the ventricle's inability to relax normally. Both of these are left ventricles. It cannot properly fill with blood during the resting period. It is less than or equal to 50% of blood ejected. Or there is right-sided heart failure, which is caused by left-sided heart failure, most times. Unable to pump enough blood into the lungs and causes fluid and pressure buildup. So, left-sided heart failure is the most common form of heart failure. The right-sided heart failure occurs normally after left-sided heart failure, but sometimes patients with certain lung diseases, you sometimes see only right-sided heart failure. The left-sided heart failure is edema in the lungs, so patients experience shortness of breath. And with the right-sided heart failure, patients, it's a backup of fluid in the veins, so you will see the swelling. If it also is called peripheral edema, so the swelling in the hands, the ankles, lower limbs, the abdomen, and this would be left-sided. So here's another picture of diastolic and systolic. Both affect the cardiac output of the blood. How to diagnose a patient with chronic heart failure. There's physical tests, blood tests, checks, x-rays, echocardiogram, electrocardiograms, stress testing, genetic testing, and heart MRIs. So here are some of the medications patients with chronic heart failure will take: ACE inhibitors, beta blockers, diuretics, statins. Most of these, or some of these, will be used together, just to enhance each other with different effects. How does exercise affect CHF? When a patient participates over time, you can see an improvement in exercise tolerance, whether that be duration or VO2 or both together. Improved peripheral and skeletal muscle function, improved autonomic nervous system, increase in maximal cardiac output at higher workloads, less fatigue, and higher peak work rate. And how does CHF affect exercise? Skeletal muscle dysfunction due to reduced O2 diffusion and or extraction, reduced cardiovascular reserve, reduced O2 delivery, reduced O2 carrying capacity, reduced O2 delivery as well, reduced pulmonary reserve, reduced alveolar, O2 exchange. All of these can cause reduced exercise and functional capacity. So some exercise testing involves cardiopulmonary exercise testing, It is a direct measure of VO2, is the most accurate measure of exercise capacity with these patients to see like where the heart is insufficient. Change in ventilation to exchanging carbon dioxide production, termed the VE-VCO2 slope during exercise test, strongly predicts prognosis. Some of the tests that I have seen the most common used are almost every single article I read doing this research says a 6-minute walk test is the most appropriate for these patients. Resistance testing could be 1 RM bench pressing for upper body or 1 RM leg press for lower body. And the flexibility tests that I said would be appropriate would be the sit and reach test. These are some things to monitor during the test. So blood pressure, RPE, should be around 11 to 14 during exercise. Don't push it too hard. Heart rate, ECG, oxygen levels. Due to some of the medications that patients may take for heart failure can affect blood pressure, heart rate. So monitoring ECG and RPE is the most appropriate for these patients. Just because heart rate and blood pressure can be affected, won't go up, or you see various levels. So this is my case study with his name is Charles Manuel. He is 69 years old. He is a male. His history involves chronic heart failure. He was diagnosed 1 year ago. He was diagnosed also with hypertension 5 years ago. He has a family history of heart attack. His father died at 52, so that puts him at a higher risk of cardiovascular disease. His symptoms include fatigue, swelling in ankles and legs, cough, shortness of breath. He does need medical clearance before we can do exercise testing. He is on medications. He's on a beta blocker, 25 milligrams twice a day, a diuretic, 40 milligrams once a day. He was diagnosed with systolic heart failure, which will, if I go back here, so his left ventricle won't contract normally, so it will affect his cardiac output. So I prescribed him for aerobic exercise. I prescribed 3 to 5 days a week. The intensity around 40 to 50% VO2 reserve or heart rate reserve, and slowly progress. The time would be about 20 minutes a day and also slowly progress. And the type of aerobic exercise would be treadmill, walking, stationary bike, or even like in a pool. If you could find a pool, water aerobics would be good, just to be a little bit more lenient on knees and ligaments. He should start doing aerobic exercise for 4 weeks, then introduce resistance training. It is very important for a client with chronic heart failure to warm up, just to get the blood going, and not to just jump right into the exercise. For resistance training, I prescribed 1 to 2 days a week with a day or two in between, just so it's not too much on his muscles. The intensity, I said 40% 1 RM for upper body, 50% 1 RM for lower body, gradually increase to 70% of 1 RM. Time 1 to 2 sets of 10 to 12 reps using major muscle groups. The type, it's a little backwards, so I would recommend starting with the resistance bands then moving to light weights, then body weight. Just for him to get a feel of what the weights could be looking like and how intense they could be. For flexibility, I said 2 to 3 days a week. The intensity, a stretch point till point of tightness. No pain involved in each of the stretches. Hold each stretch for 30 seconds, 2 to 3 times each. And the type would be static stretches, upper and lower body. So these are some of the risks that patients with chronic heart failure could experience. So sudden cardiac death. So it is very important to continuously monitor their ECG while exercising, during exercise tests, and while exercising. Maybe even before, just to get an idea of where their starting point is. And the other risk is myocardial infarction, which is more likely than sudden cardiac death. The least active patients are at a higher risk than those that exercise. So some of the precautions and modifications would be to avoid high intensity exercising, depending on the class of heart failure. Influence a balanced diet, including low sodium intake, while increasing fluid intake. Understand the other factors involved with chronic heart failure and how they affect exercise. The symptoms present, heart rate, rhythm, blood pressure changes should be closely monitored during exercise. They should always exercise, especially starting out under supervision. Start at a slower intensity and over time increase, and it's very important to cool down because you don't want to just stop and send them on their way when they should properly come down to their resting levels. So, why is it not working? Oh, these are my references. Some of the things that I have seen, how much effect chronic heart failure has on the rest of your body. So whether that be the muscles, the other organs that receive blood. It's very important to have a prescription that's like specific for them, that's not like kind of broad. So you need to take into account all of their medications, their pre-screenings, their medical clearances, any other issues they may have. Trying to find. So after the patient has been exercising for a certain amount of time, they can see these types of improvements. And yeah, thank you.